Today was my last day mentoring at Children's Hospital for this semester. I'm actually going to stay there for next semester because I've been enjoying it so much and I've had so little time in the recovery unit to observe my mentor and observe other cases and get to know the nursing profession. I'm going to stay at Children's, and while I'm doing that, I'm also going to be experiencing some occupational therapy and speech language pathology. My mentor was totally willing to find connections for me, and we're going to be doing that next semester just to give me an idea of all of the fields that I'm interested in. I'm really, really excited about that, but I just want to talk about this semester. While everything was really kind of crazy when I was switching from doctor's hospital and I had like a period of time where I had a break to finally being at Children's in the recovery unit, I wouldn't change it at all. My experience at doctors was really good for me because I got to see exactly how a hospital setting operates and how like floors work and see an inside view of patient care on the actual hospital floors and within rooms, and see a more geriatric and just general like adult population of patients. So it was really great, and I'm ever grateful for that experience. I think it was very helpful for me, and I would not have changed that. Even though I did switch from doctors to Children's, I would never take away that doctor's experience. Of course, I had that time in between being at doctors and then being at Children's. I had this time in here when I was just going home every day. I wasn't mentoring after school. It was nice, I'm not gonna lie. I got to get so much stuff done between third and fifth period during the day because I had mentorship class on Monday, and then Tuesday through Friday I had nothing for third and fourth period, and my lunch is fifth, so got to stay home through that too. But I learned a lot about time management and getting stuff done. I don't know how I would have survived first semester, especially without that period of time. I got at least 3 different assignments to finish every single day, and I was able to get lunch if I wanted to or eat at home. And I got college applications and scholarship stuff done. I was finished applying to colleges before all the deadlines even happened. I was finished in the middle of October when people were like scrambling to get theirs done on the night before they were all due. So that was really nice to finally have that relaxation and be finished with that. So what's nice is I still get that because even though I started mentoring at Children's, there's not enough time between third and fifth period. That's 3 hours and takes 20 minutes to get to Children's, so that's already 40 minutes, and it wouldn't be enough time to drive there, park, get inside, change, mentor, change, walk back to the parking lot, and drive home, and still find time to eat lunch somewhere in there. It just would not have been possible time-wise. So I still got that, but then of course I paid dearly for that when I would mentor it in the evenings, which was awesome. It was a lot of fun, and I'm really glad that I had that time to get to know all the people that are in the unit, as well as see lots of different cases, and just really see how post-anesthetic care really works, which is cool because obviously you don't get to see what's happening when you're asleep and when you're the actual patient, so it's kind of cool to be able to see that side of surgery recovery. But I would come home from school, I would go to work, and then I would go to mentor. A lot of times not getting home till 7:30, 8:30, 9:30 at night. But of course that time period in the middle of my day kind of pushed me to get stuff done. So my time management skills definitely evolved completely this semester, which is super cool and super exciting because now I feel like I will be able to handle college a little bit more, because before, I had good time management skills. I was able to get my stuff done, but now I realize I really have to plan stuff out, and I know that, and I understand how I work with my stuff, and so that was a big lesson that I learned this year. But I do want to talk a little bit more about my experience at Children's, which I am so excited to keep mentoring next semester. I wanted to keep going during break, but the hours weren't going to count, and I wasn't sure like if that would be okay, so I just decided I'll wait till after break, give myself 2 weeks off of work, schooling, and mentoring. I think that everyone kind of deserves that, but it's so much fun. I just finished mentoring tonight. It's the last day that we could mentor, and I finished mentoring at 7:30 p.m. because of all of my switching around. I obviously didn't get as many hours in the middle of the time, so I was cramming a lot these past couple of weeks at Children's, but I mean, that's okay. So tonight I went in, and it was really cool because I got to see a lot of like newer things that they're doing in surgery recovery. Today I saw 2 cap changes, which what that means is I had no idea at first, but what that means is the cap on a port for an IV, like a chest IV, they do those for especially kids that have cancer or patients in general and at all hospitals, but at Children's they do it for the kids that have cancer, and so they're receiving medicine through their IVs all the time, and because hand and foot and like arm IVs, they don't really do arm IVs, but hand and foot IVs go bad at, after like a couple days of being in, or even like hours depending. So they don't want to have to keep poking these kids and have to keep doing new IVs, because that's no fun. Even getting IVs myself, I hate it, and I'm 17 years old. And can't imagine being 5 and having to be stuck with an IV all the time. So the port IVs in their chest last a lot longer. But because these kids are so susceptible to viruses and infections and getting sick already, especially kids in remission, they have to be super sterile when they change. There's like a part in the IV that they have to change to keep it clean. They have to be like a super sterile, which just means like a super clean environment when they're changing that cap. So I had to put the gown on, and I had to put my hair up in a little hairnet, and I had the mask on, which was a little bit fun for me, I'm not gonna lie. But when they pulled the curtains around the bed and they had to change everything, and it's a longer process than you would think. The first one that I saw took maybe like 3 to 5 minutes, and the other one that I saw was a little bit shorter, but it was interesting to be able to see something like that, because they've just recently changed how they have to do things for the cap changes. So it's kind of a cool experience to get to see things that no one else is really seeing yet. But overall, with my experience at Children's so far, it's not over yet, which I'm really excited about. It's just really great to be able to see all these patients, and when they wake up, getting to interact with kids. I talked about on my last blog, my week 11, how I definitely know that I want to work with kids based on all my experiences, volunteering in different places, my work, which is, I'm a child care provider, so I babysit kids every single day after school, and, some people really can't handle kids and they get tired of them really fast, but I am always excited to go to work, and I love working with these kids, and it's so much fun. And then getting to interact with kids in a hospital setting, and it's obviously not a good place to be. You're sick or hurt or whatever. Like, you're not there just for fun. But it's nice to be able to take their minds off of that and like kind of brighten their day, and hopefully take their mind off of like post-surgery pain, because they're all gonna be hurting somewhere, most likely. And it's really cool to be able to talk to them and make a difference in that way too. And so this semester has definitely shown me that I want to work with kids and work in a medical setting, which is super, super exciting for me to at least know that. I mean, obviously I don't know yet if I want to be a nurse, an OT, or an SLP, so nurse, occupational therapy, or speech language pathologist. But at least I kind of have a general idea. I want to work in pediatrics, and I want to be in a hospital or some kind of medical environment. So at least I kind of know what I'm doing. I won't be changing my major like from one college to the next. I'll be staying in the same general field if I do ever decide to change my major. But I'm hoping that with next semester, being able to test out all 3 fields at once, I'll never have to change my major. I'll be able to try to stick with a 4-year plan, even though that's not always realistic. But I'll be able to try to stick with that plan and get in and out of college and start working and start doing what I love to do. I'm so excited to continue next semester. I'm so grateful for all of my opportunities this semester. It's been a really hectic but also organized experience, as everything new is, but it's been a lot of fun, and I'm excited to see what happens next. Thanks for following my blog this semester. It'll be continuing next semester, and I can't wait.